How does tPA treat ischemic stroke? Imagine a sudden blockage in a blood vessel in the brain that cuts off oxygen and nutrients, causing brain cells to start dying. That's what happens during an ischemic stroke. To treat this emergency, doctors often use a medication called tissue plasminogen activator, or tPA. This drug works by dissolving the blood clot that's blocking blood flow. It's a natural enzyme in our bodies that, when given as a medicine, binds to a protein called fibrin in the clot. This binding activates another enzyme called plasminogen, turning it into plasmin. Plasmin then breaks down fibrin, which is the main component holding the clot together. As the clot dissolves, blood flow is restored to the affected part of the brain, helping to prevent further damage. Timing is everything with tPA. It is most effective when administered as soon as possible after stroke symptoms appear, ideally within 3 to 4.5 hours. Giving it later increases the risk of bleeding in the brain, which can be dangerous. Because of this, healthcare providers carefully evaluate each patient to see if they are a good candidate for tPA. Factors like how long ago symptoms started, recent surgeries, medications, and overall health are all considered. During and after treatment, close monitoring is essential to catch any signs of bleeding or other complications. In some cases, doctors combine tPA with a procedure called mechanical thrombectomy, where a device is used to physically remove the clot from the blood vessel. This approach can be especially helpful for large clots or more severe strokes, providing a better chance of restoring blood flow quickly. Overall, tPA treats ischemic stroke by breaking down the clot that blocks blood flow in the brain, helping to save brain tissue and improve recovery chances. But because of the risks involved, it must be used carefully and within a strict time window. Always remember, if you or someone else shows signs of a stroke, seeking emergency medical help immediately is crucial. Only healthcare professionals can determine if tPA is appropriate, so prompt action can make a real difference.